bien si c'est utile.
Excellencies, honorable ministers, distinguished. I'm Dr. Teresa Kasaeva, Director of the WHO Global Tuberculosis Program, and I'm very pleased to welcome you to this important UN General Assembly side event co-organized by the Russian Federation and the World Health Organization. This event marks exactly 3 years this week to the UN high-level meeting on TB held in New York in 2018 that brought together heads of states. And it comes just as we have 1 year to go to reach the 2022 TB targets set in the high-level meeting. As we announced earlier this year, the status of the TB response is critical with the COVID-19 disruptions, leading to the situation when almost 50% of 10 million people which fell ill last year, missing out on access to care, and number of TB-related deaths is growing. The aim of today's high-level event is threefold. First, to understand and review the current status and progress towards reaching global TB target. Second, to advance multi-sectoral action and accountability, and to discuss preparations for the 2023 UN high-level meeting on tuberculosis. The event will build upon the success of 2 high-level UNGA side events held in 2019 and 2020, with the support of the Russian Federation, as well as the 2018 UN high-level meeting on TB and the 2017 Moscow Ministerial Conference on Ending TB. It also follows the discussions we had last year with the launch of the UN Secretary General Progress Report on TB and the 10 priority recommendations to fast-track progress. We have a distinguished lineup of speakers today, including from WHO leadership and UN leadership, the President of the UN General Assembly, health ministers and national ministerial delegations, partners and civil society, all who are invested in the same cause of wiping out this leading infectious killer. Please note that this event is being translated in all 6 UN languages. Please use the button to select your preferred language on our screen. Thanks to our audience who have joined today. We had close to 1,000 registrations for this event, and it will be live streamed on UN Web TV and posted on the WHO website. We welcome questions. Please use the Q&A function for this. This will be curated for use at the interactive Q&A session at the end if time permits. Now, I would like to introduce our distinguished speakers. And please let me start by inviting the co-hosts of the event to deliver the opening addresses. We are very pleased to have Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, join us here in delivering the opening address. He is just back from a very important mission to the Middle East, and thank you, Dr. Tedros, for your commitment and dedication towards ending TB despite your heavy schedule around COVID-19. Please.
Thank you, Teresa. Excellencies, honorable ministers, distinguished delegates, dear colleagues and friends. Tuberculosis remains one of the world's leading infectious killers. Despite being a preventable, treatable, and curable disease, this ancient disease kills more than 1 million people each year and affects millions more, with enormous impacts on families and communities. Ending TB remains a priority for WHO, and in recent years, we have made encouraging progress globally. More than 60 million people have received access to TB services since the year 2000. 109 countries have started using new effective TB drugs, and 89 countries have reported using better and faster treatments for multi-drug resistant TB in line with updated WHO treatment guidelines. But the COVID-19 pandemic has put these gains at risk. Not only does the virus pose an increased risk to people with TB, it has also caused severe disruption to essential health services, including for TB. An estimated 1.4 million fewer people received care for TB last year, 21% less than in 2019. This disruption is estimated to have caused an additional 500,000 deaths. In 2018, member states at the UN high-level meeting on tuberculosis made commitments to reach 40 million people with TB care and provide TB preventive treatment to at least 30 million people by 2022. We're lagging behind on progress to reach these targets. We have 15 months left. Urgent action is needed. The struggle to end TB is not just a struggle against a single disease. It's also the struggle to end poverty, inequity, unsafe housing, discrimination and stigma, and to extend social protection and universal health coverage. We need action and greater accountability across all sectors to end TB. Let me leave you with 3 priorities for action. First, we urge countries to restore essential TB services that have been disrupted as soon as possible. And WHO will support you to do that. This is the only way to end preventable TB deaths. Second, because COVID-19 and TB have similar symptoms, and because we need wide testing for both diseases so that people can get the treatment they need. Third, we need to urgently scale up investments to increase access to services for TB prevention and care, to accelerate progress towards the 2022 targets. Lives depend upon it. In the coming months, WHO will work with the Office of the UN Secretary General and the Office of the President of the UN General Assembly to prepare for the second UN high-level meeting on TB in 2023. The meeting will include a comprehensive review by heads of state and government to take stock of progress in the TB response and to re-energize commitments to end TB. I urge all countries, partners, and civil society representatives to redouble their efforts to achieve the targets and ramp up the response to save lives. If the pandemic has taught us anything, it's that with solidarity, determination, innovation, and the equitable use of tools, we can overcome severe health threats like COVID-19. With the same solidarity, determination, innovation, and equitable use of tools, we can end TB. We're running out of time. The clock is ticking. It's time for urgent action to end TB. I thank you.
Thank you very much, Dr. Tedros, for your inspiring and very important words. Indeed, the clock is ticking and the asks are very concrete and clear. We need concrete and urgent actions. I would like now to invite with pleasure the Honorable Health Minister of the Russian Federation, Dr. Mikhail Murashko, to deliver the next opening address. As you know, the Russian Federation hosted the first WHO Global Ministerial Conference on Ending TB in 2017, opened by His Excellency President Putin, and that put us on track to the UN high-level meeting and beyond. The Russian Federation has transitioned from being a high TB burden country this year. Although the focus on TB is not lost, and still a burden of TB, multi-drug resistant TB, and TB associated with HIV remains high. The country is committed to fast-tracking progress. We look forward to hearing from you, Honorable Minister.
Добрый день, дорогие коллеги.
Good afternoon, distinguished colleagues.
Уважаемый доктор Тедрос,
Dr.
я рад вас
Tedros, I'm
приветствовать.
very
И
happy
сегодня
to be
обсуждаемая
greeting you
проблема
today.
является
And
крайне
the
важной
topic being
на
discussed
пути
today is
снижения
extremely important
смертности и
for
бремени
the
инфекционных
reduction
заболеваний
of
во всем мире.
mortality and burden of infectious diseases throughout the
Министерство
world.
здравоохранения Российской
On behalf of the
Федерации,
Ministry of
себя
Health for the
лично,
Russian Federation
я
and
рад приветствовать
personally,
всех
I'm very
участников
glad
на
to
сегодняшнем
welcome all
заседании.
participants to today's
Мероприятие
meeting.
проходит в условиях
This event is
продолжающейся
taking place in the
пандемии
context of the continuing
COVID-19, на
COVID-19
которую
pandemic,
брошены усилия стран
against
и
which
Всемирной
the
организации
countries and the
здравоохранения.
WHO are combining their
В
efforts.
эту минуту я выражаю
At this
признательность
important time, I'd like
за
to
усилия,
thank
предпринятые
the
для
medical
борьбы с новой
community
коронавирусной
for their
инфекцией
efforts to
и
fight
другими
the
инфекционными заболеваниями,
COVID-19 pandemic and other
одним из
infectious
которых является
diseases, one of
туберкулез,
which is
ежегодно
tuberculosis,
уносящий 1,5
which
миллиона
kills
жизней.
1.5 million people per year.
Туберкулез остается сегодня
TB
важной
today
проблемой для
remains
всего
an
мира.
urgent problem for the entire world.
Последние годы Российская Федерация
Over the last few years, Russian Federation has had one of the fastest rates of TB reduction in the world and reduction in TB mortality. Over the past 20 years, the prevalence of TB in Russia has fallen threefold and mortality has fallen fivefold, reaching a historic low. Our achievements were recognized by the WHO in the form of removing Russia from the global WHO list of 30 countries with the highest TB burden. I'd like to support Dr. Tedros' words. That is to say that 2020 and 2021 were very difficult years for supporting TB patients, given limitations in medical aid and strain on the medical system, medical personnel. However, the success that we have had was supported by economic, strategic, and organizational measures of the Russian Federation, allowing us, even in this difficult COVID-19 period, to move toward reducing TB in our country. The support of the government of the Russian Federation, we're carrying out a number of medical and non-medical measures for social aid for patients with TB, including free TB medicines funded by federal and regional budgets, as well as sanatorium treatment and rehab centers, which are planned out on federal and regional levels, taking into account the situations of different regions. And when necessary, we are also strengthening our equipment base. With support of the Russian Society of Physiologists and WHO, we were able to carry out key anti-TB measures. We also actively developing scientific cooperation with leading research institutions and are developing innovative vaccines against primary TB, which is currently in the stage of clinical trials. And we are developing high-quality medicines and diagnostic tests, allowing for avoiding any side effects from screening for TB. At the same time, there are a number of problems that may make it difficult to reduce the TB burden. One of these is multi-drug resistant TB, as well as TB-HIV co-infection. Many of our anti-TB measures in our country are aimed at addressing these problems. Given the importance of reducing TB, in 2017 we held in Moscow the first global ministerial conference on ending TB, leading to the Moscow Declaration on Ending TB, which has become a guideline and basis for the 2018 UNGA high-level meeting on ending TB, outlining priority areas of countries of each WHO in order to achieve the SDG of ending TB on global and country level. We're going to support WHO and other countries in the world in their fight to end TB. During the 2023 UNGA high-level meeting on TB, we are ready to actively participate in preparation for this event. Only through combined efforts can we maintain our achievements and achieve a long-term reduction in TB during these difficult times. In conclusion, allow me to thank the countries, programs, and agencies of the UN, as well as the NGOs that are taking part in today's event. I'd like to also thank the DG of the WHO, Dr. Tedros, for successfully coordinating our work and actively being involved in our fight against TB. I'd also like to thank Dr. Teresa Kasayeva for today's event.
Thank you very much, Your Excellency, for your very kind and inspiring words, and thank you for your support to WHO and to the countries. It's critical, and especially nowadays, and your examples that you've managed to reach even in this challenging situation, anti-TB strategy milestones, shows that the progress is possible. We should double and triple our efforts. Thank you very much once again. Dear all, we are now very pleased to have the newly elected President of the 76th session of the UN General Assembly, Mr. Abdullah Shahid, deliver his address. Mr. Shahid is widely recognized as an exceptional politician and a seasoned diplomat with a long and distinguished career serving in both the government and legislature of Maldives. As you all are aware, his role as the President of the General Assembly, along with the UN Secretary General and with the support of WHO Director General, is vital in the initiation of preparations and development of modalities for the organization of the second UN high-level meeting on TB in 2023. Let's hear his address.
Excellencies, ladies and gentlemen, thank you for the opportunity to join you today. My appreciation to the government of the Russian Federation and the World Health Organization for organizing today's discussion. In 2018, world leaders adopted a political declaration reaffirming their commitment to end tuberculosis by 2030. The unprecedented political will to fight the preventable disease would translate into national and collective action, investment, and innovations. Together, the goal was to ensure that 40 million people had access to diagnosis and treatment by 2022. Dear colleagues, 18 months ago, the COVID-19 pandemic upended this commitment. None of the targets are now on track to be met on time. In fact, new data collected by the World Health Organization shows that COVID-19 disruptions could lead to 1.4 million additional people missing out on access to TB care in 2020 alone. While TB was briefly superseded by COVID-19, it's still the top infectious disease killer globally, and particularly so in HIV/AIDS patients. Identifying patients early is the key to interrupting transmission, especially due to the rise in multi-drug resistant TB strains. Added to this, fast, cheap, and accurate prognostic and diagnostic molecular tools are urgently needed. Despite these challenges, we have to bear in mind that TB is treatable and TB-related deaths are preventable in most patients. It is clear that we must ramp up the TB response in tandem with efforts to tackle the COVID-19 pandemic. Efforts to eradicate TB by 2030 should be mainstreamed through appropriate national COVID response strategies that are aligned with the Sustainable Development Goals. And we need to double funding to achieve universal access to prevent TB diagnosis, treatment, and outreach, and also research in the field. By investing now, we can save lives, ease suffering, and address the financial burden on our economies and our communities. This is particularly true for LDCs, LLDCs, and SIDS, who continue to carry an undue burden. Ladies and gentlemen, the urgency for global cooperation, solidarity, and action to fight TB has never been greater. With strong advocacy and in a spirit of shared accountability, we can build resilient health systems and ensure sustainable community-based health services. Under a presidency of hope, I look forward to working with the Secretary General, the World Health Organization, member states, and civil society to initiate preparations for the 2023 UN high-level meeting on TB. Together, we can help save millions of lives and demonstrate the success of one of the SDG indicators. The opportunity to eliminate this preventable disease once and for all should not be missed. a TB-free world by 2030. And I thank you.
It's great to hear such a strong commitments, and we are pleased to have President of General Assembly joining us as a fighter against TB. I am very pleased now share the keynote address delivered by Deputy UN Secretary General, Mrs. Amina Mohammed. She is also chair of the United Nations Sustainable Development Group. She has been a passionate advocate for TB and been part of both the UN high-level meeting on TB and the Global Ministerial Conference in Moscow. She joined us also last year for the launch of the 2020 UN Secretary General Progress Report on TB. We welcome your address.
Excellencies, honorable ministers, distinguished delegates, dear colleagues and friends, I send my warmest greetings to this event. While there has been progress on ending tuberculosis since 2018, with millions of lives saved, the COVID-19 pandemic has been a tragic setback. TB is a disease that impacts heavily on the poorest and most vulnerable. The COVID-19 pandemic has exacerbated the situation by pushing more people into poverty, vulnerability, and worsening already weak health systems. To tackle TB effectively, we must face the social drivers of the disease and work boldly across sectors. We have just over 400 days to meet the 2022 deadline to achieve prevention, treatment, and addressing multi-drug resistance TB targets set at the United Nations high-level meeting on TB. Meeting this deadline is essential to ending TB, putting us on the path to universal health coverage and achieving all the Sustainable Development Goals. We must stay focused until the job is done. We must continue to make sure that people in the hardest hit countries, cities and communities have access to TB prevention and care services. The United Nations stands with you and is committed to working together for our common goals. I thank the leadership of the World Health Organization and the Russian Federation for hosting today's event and for their continued commitment to ending this ancient killer. Today, together, we are stronger, and together we can and will succeed in ending TB. Thank you.
Indeed, a great inspiring speech. And now we turn to Paran Sarimita Winarni from Indonesia, who is a member of WHO Civil Society Task Force. Paran has experienced tuberculosis twice and multi-drug resistant TB. She is not only a survivor, but a strong warrior who has transformed her experience with TB to help others. Paran, please share with us the perspectives of the Civil Society Task Force and yourself.
Thank you. Thank you so much, Teresa, Dr. Teresa. Dear Excellencies, I would like to express my gratitude to be with you all today. My name, Paran Sarimita Winarni. I'm from Indonesia, one of the countries with the highest TB, MDR TB, and TB HIV burden. I survived from MDR TB in 2014, and since then, I actively participate as a patient supporter for others who are fighting MDR TB in Peta, Jakarta. I initiate and become the country leader of Youth Movement Against TB in Indonesia, or IMUD, as part of the global WHO Youth 1+1 initiative. I'm grateful that many doors opened of opportunity for me to involve as the voices from the community and to be affected people at the global level, such as WHO Green Light Committee of Southeast Asia, WHO Civil Society Task Force, where all the members are present from all the different regions, Global Coalition of TB Activists, TB People, and TB CAP. I'm proud to represent the WHO Civil Society Task Force on TB today in this high-level event. Ladies and gentlemen, great progress has been made toward achieving the 2020 the 2022 TB target amidst the COVID-19 pandemic, countries strive to move forward through innovation in TB care, scaling up TB prevention, engagement of civil society for a right-based, people-centered, and gender-transformative TB response involve of high-level leadership to strengthen multi-sectoral engagement. For instance, in my country, in Indonesia, the first ever presidential decree on TB was launched. Joko Widodo's leading high-level commitments to establish multi-sectoral response at the national and subnational level and instruct the creation of inter-ministerial and local level teams to accelerate to the TB response. However, we are still long away from achieving our targets. In the context of the COVID-19 pandemic, our collective progress to responding to TB has been several hampered. People with TB experience challenge in accessing the TB services. A lot of TB referral hospitals also operate as COVID-19 referral hospital. TB patients face difficulty to get inpatient when they really needed to treat their TB. No doubt that access to have the best quality of the treatment is more challenging nowadays with drugs disruption, movement restriction at the community levels, and lack of human resource in healthcare facility like masks and masks for TB prevention equipment and so on. During the 2020 United Nations General Assembly side event organized by WHO and the Russian Federation, where the progress report was launched, 10 priority recommendations were outlined. I would like to recall some of them because all of us need to ensure we implement this to reach the agreed target by 2022 and onward. The first one is we need to fully, actively high-level leadership to urgently drive multisectoral action to end TB and to reduce TB deaths. Our experience in my country, Indonesia, show that such a high-level leadership can enable steep acceleration to address TB up to the local level. It will take more than just health ministry to fight against TB because there are so many economic, political, and social determination of this disease. Without high-level leadership, multisectoral accountability, the financing, new technology, and the involvement of experts in the field, we will be unable to significantly provide opportunities in the fight against TB. Strong and meaningful civil society and affected community engagement is the key in this action across the board. Second one, country need to urgently increase funding for essential TB services, including the health workforce. As civil society and a representative of people affected by TB, we note that the TB response has been left to the health sectors, and experience demonstrate that this will not get us to the end TB. We request for the leadership for mobilizing all sectors to join the health sectors in the fight of TB. So much effort, so much investment have been made towards ending TB from donors, government, and development partners. We are in the final decade towards this goal. This is not the time to cut the funding. Instead, this is the time to increase the funding to get the last of the missing people with TB, to save the last life from TB, and to ensure families do not get impoverished by TB. We urge the donors to sustain funding to achieve the goal. This is only possible with willing and commitment from the leadership, from the national government and the global leadership. And lastly, we must ensure continued meaningful engagement of civil society, community, and people affected by TB by engaging of civil society and TB affected community in the TB response at all levels, especially during this COVID pandemic. should become not only the additional supportive factors from NTPs, but all integral part of the effective strategy to achieve the goals of ending TB. We just need opportunities to involve in this process of the government's coordination and then communication. And civil society and communities are the custodians of handling advocacy to ensure accountability and right protection. Because health is a human right. Therefore, our healthcare is also part of the democratic government system. This implies that citizens in each country must be encouraged to actively participate in decision-making that affect their health and to protect those who are most vulnerable. We ask of the leaders today, especially from high-burden regions and countries, to step up their leadership to the final of decade of TB. As we being preparation for the United Nations high-level meeting in 2023, the WHO Civil Society Task Force commit to support the preparation leading to the event, including the interactive civil society hearing. And finally, I would like to thank to WHO Director General Dr. Tedros and the leadership for the continuing to support civil societies to advance global efforts to end TB, and for strong engagement through the task force as a witness by the civil society and Director General joint statement produced in April this year. Thank you also to Dr. Teresa. Thank you.
So thank you very much, Paran. It's a real pleasure. We are so proud to work with you. You are young, but a very passionate and strong advocate. Thank you for your courage, and we hope that your voice will be heard by those to whom you are addressing your messages and requests. Following this opening session, we will have 2 sessions at this event. The first will focus on country progress and preparations for the next high-level meeting. And we are very pleased to have high-level participation with the ministers and other leaders joining. The second session will be an interactive panel with heads of agencies and partners, highlighting key priorities as we look towards the 2022 deadline for targets and the high-level meeting. This will be followed by an interactive Q&A session and closing. So let us now move to the Ministerial Panel. As I told, we have a lineup of honorable health ministers from 6 countries: Nigeria, Pakistan, Brazil, Indonesia, India, and Mongolia, the honorable vice minister from Vietnam, the ambassador for global health from France, and the vice commissioner from China. It's an impressive group of leaders showcasing strong commitments from countries. Focus of all speakers in this session will be on sharing their experience, progress towards achieving 2022 targets committed by the heads of states, especially in the context of COVID-19 pandemic, and key actions taken to build multi-sectoral engagement and accountability to end TB. The perspectives of the country looking forward to the 2023 UN high-level meeting on TB will be also shared. And it's honor to start with invitation of the Honorable Assistant to Prime Minister of Health of Pakistan, Mr. Fasai Sultan. Please, Your Excellency, floor is yours.
Thank you very much. Excellencies, ladies and gentlemen. The 2018 UN high-level meeting, political declaration on TB, garnered unprecedented global momentum to accelerate the TB response and achieving the first milestone of finding and treating 7 million TB cases in 2018. With this trend, it was expected that the missing TB, people with TB would be brought down sufficiently by the year 2022 to enable countries to reach the end TB targets. Though the UN HLM target was for 2018 was met by most countries, further progress has been stalled and is in fact at risk of being reversed by the COVID-19 pandemic. The pandemic has adversely affected many disease control programs in Pakistan as well, one of which, of course, is TB. Pakistan has the unique distinction of preventing the healthcare system from devastation because of the COVID-19 pandemic. Healthcare services continue to function and deliver, though not optimally during the initial phase of the pandemic when TB notifications went down and TB lab testing was decreased by 80% immediately after the initial COVID-19 outbreak. The reduction in drug-sensitive and drug-resistant TB case notifications went down to 50% and 35% respectively. So this was partly due to diversion of the workforce towards COVID-related work and partly because of restrictions in movements and lockdowns. We were able to recover quickly from the effects of lockdowns and are catching up on the case notification and striving to perform optimally on all KPIs. Pakistan is in the process of strengthening its healthcare system and infrastructure, and our approach to disease control has changed and now takes into account evolving needs and context. The three pillars on which we are able to focus to mitigate the effects of COVID-19 pandemic on TB and also on other diseases are: 1, infection prevention and control; 2, strengthening of diagnostic facilities; and 3, digitization of systems. So in conjunction with the enhanced community engagement, we will ensure that no section of the population is left behind. A little bit on strengthening of systems. First, we are directing our efforts on the TB program to actually benefit from the COVID-19 response, including heightened attention to public health measures, such as infection prevention and control, contact tracing, active case finding, preventive treatment, strengthening labs and networks, and disease surveillance. 2, engagement of the public and private sector through close collaboration with healthcare commissions, regulators, and other institutions. Previously, the disease control programs were vertical and working in silos, and we are actively working towards integration of different programs. Expansion and implementation of strategies and plans will be enhanced through partnership with provincial health regulators, with academia, as well as with research-oriented and public health institutions, which are willing to help the government in achieving the SDGs. On digitization, meaningful data capture and reporting, which will facilitate contact tracing and follow-up and monitoring of outcomes of TB. This will be projected on live dashboards to support objective data-driven decision-making. Ensuring provision of diagnostic X-ray facilities and upfront gene expert testing at TB centers is an important component. Diagnostic confirmation remains suboptimal, partly because of the lack of availability of these at the primary healthcare centers. And so we hope to make patients' life easy by providing one-stop solutions instead of referring them here and there. This inconvenience also leads to failure to capture. We believe that the ongoing training of doctors and healthcare workers is important for optimal diagnosis and optimal management, and are trying to have a sustainable system for this purpose. Any healthcare facility which provides TB services should be equipped with the basic services for other communicable diseases like HIV and other non-communicable and other diseases like non-communicable diseases. We are strengthening the infection prevention and control practices at healthcare centers to make them safe, not just for TB and COVID, but for other diseases that can be transmitted. And this includes improvement of waste management, which of course is pivotal in this regard. And it is being addressed through incorporation of strategies in existing TB and HIV programs. Monitoring KPIs to ensure that the programs are on track and delivering what they're supposed to deliver. And lastly, document success and challenges when implementing innovative approaches and intervention to inform and guide further scale up and build on the lessons learned from the challenges. And so where appropriate, feasible and operational research will be conducted to determine their impact. Multi-sectoral collaboration has been initiated, and a baseline assessment has been conducted, which identified the gaps and helps to integrate. And this includes high-level advocacy, forum at federal and provincial governments with the chief executives, collaboration across different government ministries like finance, home security, pharmaceutical, agriculture, industry, and corporate affairs, to mobilize elected parliamentarians and medical professional associations and other communities and civil society and media to reach out to decision makers. TB programs are to maximize equitable access to both drug-sensitive and drug-resistant services through linkages with social security programs. And of course, the use of universal health coverage TB programs should be able to capitalize on the wider health and social protection initiatives that exist and are being expanded to enable a response to emerging epidemics in providing integrated people-centered health services. And with this, I'd like to end my comments. Thank you very much for your attention.
Thank you very much, Your Excellency. Special thanks for highlighting and promoting the fundamental principles of the universal health coverage, access to care, equity, and people-centered approach. Indeed, these are the key principles, and we will continue working with you on it. And Pakistan is, of course, one of the highest burden countries in the region, and without progress in Pakistan towards ending TB, the progress in the region is not possible. So that's why we are looking. We will continue working with you to move towards our goals. And of course, very important actions undertaken on the implementation of the multi-sectoral accountability framework in the country. Thank you. Now I would like to give floor to His Excellency, Honorable Minister of Health of Brazil, Mr. Marcelo Queiroga. Please, Excellency, floor is yours.
Organização Mundial de Saúde, Dr. Tedros Adhanom, Dr. Mikhail Murasko, Ministro da Saúde da Federação Russa, minhas senhoras, meus senhores, o Brasil é considerado pela Organização Mundial da Saúde um dos países de alta carga para a tuberculose, para a co-infecção tuberculose HIV. Por isso, o Ministério da Saúde tem iniciativas multissetoriais, que inclui um mecanismo de revisão em nível nacional com o engajamento das principais partes interessadas, conforme recomendado na Declaração Política das Nações Unidas de 2018. Este ano, revisamos e publicamos novo Plano Nacional de Tuberculose com vigência de 2021 a 2025. Trata-se de um documento estratégico, operacional e específico que articula os esforços de controle da tuberculose no Brasil e, ao mesmo tempo, aponta a coerência de ações em nível nacional e internacional, nomeadamente no âmbito da estratégia global da Organização Mundial da Saúde para o fim da tuberculose. Para tal, levamos em consideração tanto os avanços já realizados em direção às metas de tuberculose, como os impactos da pandemia de Covid-19 nos serviços de saúde, de prevenção da tuberculose, diagnóstico e tratamento. O Ministério da Saúde do Brasil considera a estrutura de responsabilização multissetorial como uma ferramenta importante para melhorar a governança da resposta à tuberculose em nível nacional e internacional. Nosso Programa Nacional de Tuberculose vem desenvolvendo atividades colaborativas para atender às necessidades de atenção à tuberculose, especialmente às populações de alto risco. No que se refere à promoção da proteção social, o importante avanço em 2001 foi o acordo de cooperação interministerial entre o Ministério da Saúde e o Ministério do Desenvolvimento Social para amparar pacientes com tuberculose. Desde a Declaração Política de 2018, muitas inovações foram incorporadas ao sistema de saúde pública com o objetivo de atingir as metas, tais como a implantação da vigilância online de pessoas com tratamento de ILTB, com mais de 65 mil pacientes sob vigilância em todo o país. O lançamento, em 2020, do monitoramento do tratamento de ILTB entre pessoas que vivem com HIV e com baixa contagem de CD4, grupo prioritário para o tratamento preventivo da tuberculose no Brasil. Em um ano de monitoramento, mais de 150 mil PV-HIV sob vigilância. A incorporação de novas tecnologias para o diagnóstico de ILTB e MDR-TB, a atualização dos tratamentos de TB-MDR em alinhamento com as recomendações da OMS através da incorporação ao sistema de saúde pública de bedaquilim e Delamanide. Para 2022 em diante, é necessário fortalecer os órgãos existentes de controle social, dos compromissos e dos avanços para a erradicação da tuberculose com os conselhos participativos de saúde. O Brasil endossa o compromisso de erradicar a tuberculose até 2030, trabalhando com base no Plano Nacional de Tuberculose, alinhado com a visão, princípios, pilares e metas da estratégia para acabar com a tuberculose da Organização Mundial de Saúde. Ainda há muito a ser feito para alcançarmos o fim da tuberculose. Seguimos abertos ao diálogo e à cooperação, visando a garantir proteção à saúde de nossas populações, sem perder de foco o fim da tuberculose. Muito obrigado.
I would like to thank Honorable Minister for keeping focus on TB even during the COVID-19 pandemic. You've highlighted many important commitments, and we know that you are undertaking important actions, but I would like just to highlight one of them, focus on the TB prevention and TB preventive treatment, which is extremely important, and we hope that Brazil will continue promoting and achieve finally the target for the country, because I would remind you, for providing TB preventive treatment, for reaching the target of 30 million, we are still lagging behind. Thank you very much once again. Now I would like to turn and to give floor to His Excellency Honorable Minister of Health of Indonesia, Mr. Budi Gunadi Sadikin. Please, Minister, floor is yours.
His Excellency Dr. Murasko, Minister of Health of the Russian Federation, Dr. Tedros, distinguished speakers, ladies and gentlemen. Since Dr. Koch identified the causative agent of tuberculosis in 1882, the world has seen a remarkable decline in tuberculosis morbidity and mortality. However, unfortunately, the decline has been unequal between high-income and lower-income countries. A less dramatic progress in lower-income countries enables tuberculosis to remain as a major global health problem. This is very unacceptable. The white plague no longer has a place in the history of mankind. We affirm this because we now have the weapons to win the fight. But the pandemic halts many of the progress we have achieved in controlling tuberculosis, and therefore, we will need to work even harder. For Indonesia, a concerted and drastic efforts are needed to reduce the current national TB incidence rate of 301 per 100,000 persons to reach 65 per 100,000 persons by 2030. For its own part, Indonesia has first issued the Presidential Decree on Tuberculosis Prevention and Control to pursue and accelerate a more concerted multi-stakeholder effort. We realize that controlling TB requires not only health intervention, but more importantly, socio-economic and environmental interventions. Second, Indonesia allocated sufficient budget, especially by increasing the 20 and 21 budget, to catch up with the disruptions caused by the pandemic. Within the increased budget, a good portion of it is to improve active case finding, including by empowering communities through community health workers, is dedicated. Third, Indonesia increased TB testing coverage, including through the promotions of bidirectional testing to provide TB services for people with diabetes at the earliest time possible. Fourth, Indonesia accelerated the provisions of TB prevention treatment as a part of our prevention measures. We commit to provide TPT to at least 3.6 million high-risk individuals by 2024. This approach is crucial to achieve the national and global TB targets, as we are fully aware that curative measure alone is insufficient to eliminate TB by 2030. And fifth, we are committed to strengthen collaboration with international partners in filling the gap on our national TB prevention and control program, because tuberculosis is everybody's business. Excellencies, ladies and gentlemen, what more can we do to achieve the SDGs 2030 target for TB? The pandemic shows that to end a persistent global health problem requires strengthening across the health system building blocks. We need a health system transformations from having strong primary and secondary care to achieving universal health coverage and take advantage of digital health technology. The pandemic has also taught us that collaborations across different stakeholders, both within and among countries, is important to deal with a complex global public health problem such as TB. Hence, I call for governments, communities, private sectors, donors, and other international development partners to share the burden by working collectively, especially to move toward achieving the TB SDGs target post the pandemic. There is no resting for any of us till we redeem our pledge in full, till we achieve our target to provide a world free from this ancient disease. We need to speed up our game because it is time to end TB. Thank you.
We would like to thank His Excellency Minister of Health from Indonesia. And this is another outstanding example of the prioritization of the TB problem, TB programs, even during COVID, and also increase of the investments in TB response. Indeed, we need strong collective actions, multi-sectoral actions. This is the only one way out in the current exceptional circumstances. With this, I would like now to turn and to give floor to the representative, high-level representative of one of the highest TB-burdened country, also demonstrating outstanding leadership, to His Excellency, Honorable Minister of Health and Family Welfare of India, Mr. Mansukh Mandaviya. Please, floor is yours.
The WHO Director General, Dr. Tedros Adhanom Ghebreyesus, Honorable Health Ministers, officials from member countries, ladies and gentlemen, Namaste. As per the vision of our Prime Minister of India, Sri Narendra Modi, India has given the highest priority and shown serious political commitment to the fight against tuberculosis. We have a national target to end tuberculosis in our country by 2025, 5 years ahead of the SDG 2030 target. India's commitment to the global efforts for fighting TB covers a range of intervention, namely high-quality drugs, effective use of digital technology, engaging the private sector and affected communities, and integrating TB services across all levels in the health system. All these efforts are already helping us to rapidly decline TB incidents and mortality in the country by taking timely mitigation measures, including integration of TB and COVID-19 bi-directional screening, doorstep collection of sputum samples, and delivery of drugs. Teleconsultations through e-Sanjeevani platform, which is a mobile app-based medical consultation service provided by Government of India, and digital intervention for monitoring adherence. Due to these efforts, we have seen the country return to pre-COVID levels of monthly TB notification of around 0.18 million August 2021. We have initiated sub-national certification of districts and state level for measuring achievement on progress towards TB-free status, measured with graded milestones of decline in TB incidence compared to 2015 levels. Friends, I am proud to announce in this forum that the Union Territories of Lakshadweep and the district Budgam in Jammu and Kashmir have been certified as the first TB-free Union Territories and first TB-free district in the country. Timely diagnosis and prompt treatment are key to TB elimination. We are expanding and accelerating universal TB care coverage and preventive service in the country, with TB now integrated with Ayushman Bharat, the largest comprehensive healthcare program in the world. Our Atmanirbhar Bharat model, announced by the Honorable Prime Minister Narendra Modi, will be at the center of transforming the entire Indian healthcare ecosystem. We are also working diligently to strengthen our public health system to respond to infectious diseases. Dedicated infectious disease hospitals have been set up as a part of our pandemic preparedness and response. They would contribute significantly to TB care and management going forward. We have also increased our rapid molecular diagnostic capacity across the country. These multi-platform devices will ensure decentralized TB diagnosis. Better infection control will improve the transmission dynamics, particularly in the health facilities. From 2014, India particularly focused on cleanliness through Swachh Bharat Abhiyan and important behavioral change in society acquired during the pandemic, such as cough hygiene, use of mask, social distancing. We further help reduce the transmission of respiratory illness along with tuberculosis. We have also been successful in creating an inclusive environment, collaborating with several public sector companies, medical colleges and institutions, private healthcare providers, development partners, and the community in critical areas of TB care like treatment, diagnostics, logistics and supply chains, monitoring and operational research. Will we be able to realize our dream and destigmatize TB? Towards this, we have launched a TB Mukta Bharat campaign to bring together all citizens of this country and make it a people's movement. I am also confident that our collective thought and unified action will lead us eliminating this disease from the face of this planet. Jai Hind.
Thank you very much, Excellency. Very ambitious targets and plans, inspiring commitments, and very impressive concrete actions. The whole world is looking at India, and we understand that without progress in India, global progress and success will not be possible. So thank you once again. Now I would like to give a floor to His Excellency, Honorable Minister of Health of Mongolia, Mr. Serijav Enkbold.
Нэгдсэн үндэсний байгууллагын ерөнхий чуулганы албан ёсны нээлтийн арга хэмжээнд оролцож буй эрхэм хүндэт төрийн тэргүүд, сайд нар, түнш байгууллагууд болон иргэний нийгмийн төлөөлөл, ноёд хатагта та бүхэнд энэ өдрийн амар амгалан ажилтнаа мэдчилье. Хүн төрөлхтний хөгжлийн хугацаанд нийгмийн халдвар төвчин хэмээн нэрлэгдэж 21-р зууны чимээгүй тахал болсон сэрээ өвчин улс орнуудын эдийн засаг, хүний эрүүл мэндэд ихээхэн хохирол учруулан асуудал дагуулсаар байна. Манай улс Дэлхийн эрүүл мэндийн байгууллагын номхон далайн баруун бүсийн хэмжээнд сэрээгийн өвчлөл өндөртэй орны нэг бөгөөд 2021 оноос сэрээгийн өвчлийн дарамт өндөр байгаа дэлхийн 30 улсын нэг болоод байна. Сүүлийн жилүүдэд улсын хэмжээнд бүртгэгдсэн нийт халдвар төвчний 10%-ийг сэргийн өвчин эзэж жил бүр 3,000-аас 4,000 орчим сэргийн халдвар шинээр бүртгэгдэж халдвар төвчний шалтгаан нас оролтын донд 1-р байрт орж байна. Нью-Йорк хотод 2018 оны 9-р сар зохион байгуулагдсан Нэгдсэн үндэсний байгууллагын ерөнхий ассамблеийн 73 дугаар чуулганаар сэргийн өвчний асуудлыг тусгаалan хэлэлцсэн бөгөөд сэргийн өвчнөд тэмцэх, сэргийлэх, өвчтөн, өрх гэр бүл болон эрүүл мэндийн салбарт үзүүлж байгаа эдийн засгийн дарамтыг бууруулах чиглэлээр онцгой анхаарал хандуулж өргөн хүрээнд хамтран ажиллах талаар дэлхийн улс орнууд үүрэг амлалт авсан билээ. Сэргийн өвчнийг устгах Москвагийн тунхаг, сэргийн өвчнийг устгах Нэгдсэн үндэсний байгууллагын улс төрийн тунхагт туссан зорилтыг хэрэгжүүлэх хүрээнд Монгол улс их хурлын гишүүдийн санаачлагаар сэрээгүй Монгол лобби бүлэг байгуулагдаж сэрээтэй тэмцэх, сэргийлэх үйл ажиллагаанд зарцуулах засгийн газрын санхүүжилтийг нэмэгдүүлэхэд онцгойлон анхаарч байна. Түүнчлэн сэрээтэй тэмцэх, сэргийлэх үйл ажиллагаанд засгийн газар, эрүүл мэндийн салбарын болон бусад салбар хоорондын хандивлагч талууд, иргэн нийгмийн байгууллагууд, хувийн салбарын оролцоо, үүрэг хариуцлагыг нэмэгдүүлэн хамтын ажиллагааг сайжруулахыг чухалчилж байна. Улмаар Монгол улсын ерөнхий сайдын ивэлд ор доктортой хөгжлийн эрен үед сэргийн өвчнийг устгах олон талт хамтын ажиллагаа үндэсний чуулганыг 2018 онд амжилттай зохион байгуулсан бөгөөд оролцогч талууд үүрэг амлалт авч Монгол улсад сэргийн өвчнийг устгах Улаанбаатарын тунхагийг гаргасан. Үүнтэй холбоотой дараах арга хэмжээнүүдийг хэрэгжүүллээ. Үүнд Монгол улсын доктортой хөгжлийн үзэл баримтлал 2030, эдийн засаг нийгмийн хөгжүүлэх үндсэн чиглэл, Монгол улсын засгийн газрын үйл ажиллагааны хөтөлбөрт сэргийн өвчнөд тэмцэх, сэргийлэх бодлого чиглэлийг тусган ажиллаж байна. Сэргийн тусламж үйлчилгээнд зарцуулах засгийн газрын санхүүжилтийг 2018 онтой харьцуулахад 25%-аар, сэргийн эмч мэргэжлийн цалингийн хэмжээг 30%-аар тус нэмэгдүүлсэн. Монгол улсын засгийн газраас 345 дугаар тогтоолыг багтлан сэргийн эмчилгээний 2 дугаар игнэний чанарын шаардлага хангасан эмийг олон улсын эм ханган нийлүүлэх байгууллагаас улсын төсвийн хөрөнгөөр шууд худалдан авч нийлүүлдэг болсон. Сэргийн худалдан авахд жил дунджаар 1.5-аас 1.8 тэрбум төгрөгийг улсын төсвийн хөрөнгөөс, 1.5-аас 2 тэрбум төгрөгийг глобал сангийн дэмжлэгтэй сэргийн төслөөс тус зарцуулж байна. Дижитал болон молекул биологийн орчин үеийн технологиг сэргийн тусламж үйлчилгээнд нэвтрүүлснээр үндэсний төв, орон нутгийн эрүүл мэндийн байгууллагын сэргийн илрүүлэлт онцлогооны чадвар нэмэгдсэн. Монгол улсын эрүүл мэндийн даатгалын тухай хуульд нэмэлт өөрчлөлт хийж, эрүүл мэндийн байгууллага нэг худалдаа авагчийн тогтолцоон шилжснээр сэргийн тусламж үйлчилгээний төлбөрийг эрүүл мэндийн даатгалын сангаас санхүүжүүлж эхлээд байна. Коронавируст халдварын цар тахлын нөлөөлөл бидэнд төдийгүй хүн төрөлхтөнд сорилт болж байна. Монгол улсад коронавирус халдварын 270 мянга гаруй тохиолдол бүртгэгдэж, вирусын шинэ хувилбараар үүсгэсэн томоохон давлгаанд өртөж, тохиолдлын тоо нэмэгдсээр байна. Үүнтэй холбоотой сүрээгийн тусламж үйлчилгээний доктортой байдлыг хангах, сүрээ COVID-19-ийн хариу арга хэмжээг нэгтгэн ажиллах талаар бид анхаарч байгаа хэдий ч нийтийг хамарсан хөл хорой тогтоосон сүрээгийн мэрэгжлийн эмч, эмнэлгийн мэрэгчлэнүүдийг цар тахлын хариу арга хэмжээнд дайчилсан зэрэг нөхцөл байдлаас шалтгаалan сүрээгийн илрүүлэлт, онцлогооны хамрагдалт 2019 онтой харьцуулахад 2 дахин буурсан. Цаашид сүрээгийн тандалтын тоо бодит хугацаанд мэдээлэх, захимжуулах, хүний нөөцийг үргэлжлүүлэн бэлтгэх, чадахжуулах, эмчилгээ, эмнэлэг зүйн тусламж үйлчилгээний шинэ арга технологиг нэвтрүүлэх, эрдэм шинжилгээний судалгааны ажлыг үргэлжлүүлэх, иргэний нийгмийн оролцоог хангасан, олон талт хамтын ажиллагаагаар дамжуулан сүрээгийн тусламж үйлчилгээний хүртээмжийг нэмэгдүүлэхэд чиглэсэн цогц арга хэмжээнд та бүхнийг бидэнтэй хамтран ажиллана гэдэгт итгэлтэй байна. Монгол улсын хувьд нийтийн эрүүл мэндийн тулгымдсан асуудал болоод байгаа сүрээ өвчтөнтэй тэмцэхэд стратегийн гол түншлэгч болдог дох сүрээ хумхан өвчтөд тэмцэх галбаа сан, дэлхийн эрүүл мэндийн байгууллага болон бусад хандивлагчид, олон улсын байгууллага, үндэсний мэрэгжлийн баг хамт олон эмч мэрэгжилтэн та бүхэнд чин сэтгэлийн талархал илэрхийлье. Анхаарал хандуулсанд баярлалаа.
We also thank His Excellency Minister for joining us today and for sharing with us challenges and advantages in the fight against TB in Mongolia. And as we know, this year we've updated list of high-burden countries, and unfortunately, Mongolia is one of the countries joining this list, but we hope that it will not be a long journey remaining in the list of high-burden countries, and with these strong commitments and efforts, country will succeed and move towards TB, ending TB and further elimination. Now I would like to give floor to His Excellency, Honorable Vice Minister of Health of Vietnam, Dr. Nguyen Trong Son. Please, floor is yours.
Over the past year, Vietnam has been making significant effort and progress toward ending TB by 2030. Vietnam has achieved the target of global end TB strategy of reducing 34% in TB death, which is from 15 per 100,000 population in 2015 to 9.8 per 100,000 population in 2019, and also reducing 12% of incident. The reduction of TB death is nearly reached to the global target for 2020 for 35%. Yet, there have been more 500,000 TB cases treated for the last 5 years, and the reduction of TB incident rate has not reached to the global target for 20%. We must admit that Vietnam is still considered one of the high TB burden countries in the world. Moving this forward, the government of Vietnam has demonstrated a high political commitment to end TB by 2030. A National Committee of Ending TB chaired by Mr. Vũ Đức Đam, Deputy Prime Minister, and members from relevant sector are mandated to coordinate the implementation of the National Action Plan target to end TB by 2030 by 2 objectives. The first one is detect and treat all active TB, and the second is screen and treat latent TB. The National Action Plan is in line with the global end TB strategy. Like other countries in the world, Vietnam has been struggling with the ongoing COVID-19 pandemic that has been causing heavy impact to health sector, including the TB program in Vietnam. The case notification in 2020 reduction 3.1% compared to 2019. The average reduction of the global is 31%. But This reduction is expected more seriously in 2021. While the National TB Program and all TB system has been actively participate in COVID-19 response, Vietnam is trying to maintain TB services as much as possible by protecting safety of TB hospital and TB staff from COVID-19, applying the new technology, such as telemedicine, artificial intelligence technology, in reading chest X-ray film to diagnose TB, applying short-term treatment regimen, and new technology in the monitoring adherence to treatment of TB patients. For coming high-level UN meeting on TB in 2023, the government of Vietnam continue its strong political commitment to accelerating implementing successfully the Global Fund period 2021 to the 2023, the NAP to NTB by 2030 through multi-sectoral approach. Those are integrating TB into the revision of the law of communicable disease control, optimizing the health insurance policy into TB control, and applying the new technology and introduce innovation, including the new drug and vaccination. In context of new future of living together with COVID-19, impact and lesson from COVID-19 on TB program will be assessed to have appropriate measure for maintaining and accelerating TB activity toward achieving ending TB by 2030 in Vietnam.
We thank His Excellency Vice Minister of Health of Vietnam for moving forward, for presenting us example of movement forward and towards ending TB in the country, and also for playing very important role at the global level. I can't miss this opportunity, and I would like to thank the leader of the National TB Program, Professor Nguyen, for his dedicated hard work, showing the example to many other countries. Thank you once again. And now I have a pleasure and honor to introduce our next speaker, Her Excellency Ambassador for Global Health of France, Mrs. Stéphanie Seydoux. Before I give floor to her, I would like to say that France is playing a very important role in the global health arena and in the fight against TB, not being high TB burden country, but making so many contributions, financial, investing with technical expertise all over the world and in the highest TB burden countries. With this, I would like floor to you, Your Excellency.
Спасибо вам большое. Добрый день, уважаемые дамы и господа.
Good afternoon, ladies and gentlemen.
Mesdames et messieurs. Je souhaiterais tout d'abord
Ladies and gentlemen, I would like first of all to commend the involvement of Russia as well as the WHO, guided by Dr. Tedros himself. I think this meeting is quite timely, coinciding with the UN General Assembly. It picks up where the 2018 high-level meeting left off, and we have prospects for the 2023 meeting on ending TB. I'd also like to say that the mobilization of the international community, the establishment of a global fund to fight AIDS, tuberculosis, and malaria in 2002, and that of UNIDATE in 2006 has helped us to progress greatly toward fighting these diseases and to eliminate them by 2030. And thank you, Ms. Kasaeva, for mentioning that France is playing an important role, providing a great deal of financial support and multilateral, bilateral support to developing countries via its agency programs, including AFD programs and expertise France as well.
considérable de la lutte contre la
Given
tuberculose
the
et conformément à ses
scale of this
engagements en faveur
challenge
des
of
objectifs de
fighting
développement durable,
TB and in
la
alignment
France
with its
poursuit résolument
commitments
le
under the
combat contre la
SDGs,
tuberculose
France
aux côtés
is
des
working
acteurs
to combat
nationaux, dont beaucoup se sont
TB
exprimés avec
via our
force
national
aujourd'hui,
actors
de l'OMS
who
et
have spoken
des
today,
fonds
as well as
multilatéraux
WHO
comme
and
l'aide, le Fonds mondial et
multilateral funds,
le
including United, the
partenariat
Global
Stop
Fund,
TB. Je salue
and the
la
Stop
docteure
TB
Dikiu qui est avec nous aujourd'hui et Gavi.
partnership, and Gavi.
Malgré les projets durement acquis ces dernières années, les progrès restent fragiles. La
The
mortalité
progress
due à la
we've
tuberculose a
made,
reculé de
we
plus
have a
d'un
long way
tiers depuis
to
20
go.
ans. Et 10 millions de
Mortality has
personnes
fallen
chaque
by a
année
third
continuent de contracter
the
cette
past
maladie.
20 years, but 10 million people
La
affected
pandémie de
every
Covid a
year.
eu un impact
The
dévastateur
COVID
sur le
pandemic
dépistage,
has had a
avec une baisse de
major
près de 40%
impact
en
on
Afrique et en Asie,
screening, with a drop of
et également sur la
20% in
mortalité
screening.
en raison
Has also had
de
an effect on
l'amplification de la
attitudes
détresse respiratoire en cas de
with
co-infection au
regards,
Covid et à la
and as well as on
tuberculose.
public health in terms
Mais
of
au-delà du
the
Covid, on sait que
comorbidities of
la pauvreté, la
COVID-19
faiblesse des
and
systèmes de santé,
TB,
les
and severe
inégalités de
weaknesses in our
genre,
healthcare
la
systems, the gender
stigmatisation et les violations
inequality,
des droits humains
stigmatization,
comptent parmi les
human rights
principales
violations.
causes
These are some of
de problèmes dans
the leading
l'accès aux outils de
causes
prévention,
of
de dépistage
problems when it
et de
comes to access
traitement
to
de la
prevention,
tuberculose.
screening, and treatment
Autant de
of
déterminants de la
TB.
santé renforcés par la crise du Covid-19.
These are all healthcare
En
factors that were
parallèle,
aggravated by
l'expansion des
COVID-19. At the
résistances au
same
traitement
time,
et
rising resistance
menace de plus
to
en plus les
treatment
avancées obtenues au
is
cours
an
des
increasing
dernières années.
threat to the progress we've made over
Aujourd'hui,
the
le
past
constat est clair, la recrudescence
few
des grandes
years.
pandémies est un risque
We've
avéré,
seen that resurgence
aggravé
of
par la crise
major
sanitaire
pandemics.
moderne.
That's a risk
Au-delà
that
des
has
financements
been exacerbated by the current
l'augmentation des financements
crisis.
domestiques dédiés à la santé
Increasing
apparaît
domestic
plus que
financing
jamais
for
nécessaire pour
healthcare is
sécuriser les
more
acquis et
urgent than
obtenir la
ever
fin
in order
de
to
ces pandémies
protect
d'ici à 2030,
our
comme l'ont
achievements
bien
and
indiqué tous les
to
honorables
work toward our
interlocuteurs qui se sont
2030
exprimés
goals,
avant
as
moi.
mentioned by several of the
Plus que jamais, il
previous
faut
speakers.
renforcer durablement les
More
systèmes
than
de
ever,
santé,
we
les
need
capacités des
to
pays sur
reinforce
des
our
questions
healthcare
clés
systems and
comme les
countries'
systèmes de
capacity
surveillance, les
to
chaînes
address key
d'approvisionnement
issues such
ou
as the monitoring
encore la
systems, supply
consolidation des
chains,
ressources humaines en santé,
or
notamment
consolidating
via la formation des
healthcare
professionnels de santé, qui
personnel
est un point
by training
absolument
healthcare
crucial.
professionals, which is absolutely
La France
crucial.
appelle donc à la poursuite de l'action internationale
France
contre la
calls for continued
tuberculose,
international
fondée sur des
action
valeurs de
against
solidarité
TB
et
based on
d'accès
solidarity and the
universel
principle
aux
of
outils de
universal
prévention et de
access
traitement.
to
Nous
prevention
avons agi
and
en ce
treatment
sens
for
en
TB.
2019 en augmentant
In
de 20%
2019,
notre
we
contribution
increased
en
by
Fonds
20%
mondial.
our contributions
Nous
to the
veillerons, en
Global
tant que
Fund.
deuxième bailleur historique du Fonds mondial, à ce
We're
que
the second
les
largest
importantes capacités
donor into
financières
this fund.
déployées par le Fonds mondial, qui fournit les 3/4 du financement mondial de la lutte contre la tuberculose, permettent
Over
son élimination.
75% of global efforts against TB can
L'engagement
help
historique de la
promote
France contre la
elimination of TB.
l'engagement de la France contre la
France's
tuberculose est
commitment
historique,
to
puisque c'est en
fighting
France, il
TB
y a
is a
100
historic
ans
one
qu'a été découvert
because
le vaccin
100 years
BCG
ago in
par
France,
les équipes de Louis Pasteur.
the
Et
VCG
notre pays accueillera
vaccine
en
was discovered
février
by Pasteur
2022
and his
le
team.
6e
And in
Forum
February
mondial sur les vaccins
2022, we'll be
contre la
holding the 6th Global
tuberculose.
Forum
Ce sera un
on
événement
TB
majeur de l'année
vaccines, which is an
2022
important
avec une
milestone of
mobilisation à la fois
2022.
politique et
It
scientifique.
involves both
Un
political
forum
and
qui a pour
scientific
ambition de
mobilization.
renforcer
The
la
goal of this
coopération
forum is to
internationale,
strengthen
notamment
international
avec les pays en
cooperation,
développement.
especially with
Ce sera
developing
l'occasion de
countries. This
sensibiliser
will also
les
be
décideurs
an
politiques et les
opportunity
partenaires
to
industriels à s'investir dans le défi mondial
motivate
de
our
santé
political
publique que
leaders,
représente la
business
lutte
leaders
contre
to
la
invest more
tuberculose. Nous
into
sommes
the
encouragés, après le
public health
succès
issue
des
of
vaccins contre le
tuberculosis,
Covid, à faire
the success
advenir
of
rapidement
COVID-19
de nouveaux
vaccines.
vaccins efficaces contre la
And this may
tuberculose
lead
qui
to
devront
development
être
of new
rendus
effective vaccines against
accessibles à
TB,
tous.
which ought to be accessible
La pandémie
to
de
all.
Covid-19 a tout
The
bouleversé,
COVID-19
ébranlé nos
pandemic has
espoirs,
changed
mais la réponse
everything
multilatérale massive et
and
sans
has
précédent à cette
sometimes
pandémie nous a montré
been
qu'il était
discouraging, but
possible,
the
avec une
response to this
mobilisation mondiale,
pandemic has
d'assurer
shown that
l'accès
global
aux vaccins, aux
mobilization
diagnostics et
can
aux
ensure
traitements
access
partout
to
en même temps.
vaccines,
C'est ça qu'il
to
faut mettre en
diagnostics, and
œuvre
to
pour en finir
treatment. This is what
avec
we
la
must
tuberculose.
work toward in order to
En
end
conclusion, j'espère vous retrouver
TB.
en
In
France en
conclusion, I
2022
hope to
et
see
je
you in
vous
France in
remercie de votre
2022,
attention.
and I thank you for your
Спасибо
attention.
вам большое.
Thank you very much.
Merci beaucoup, Madame Ambassador. Спасибо.
Thank you very much, Madam Ambassador.
indeed more than ever strong support from France, and we believe that our collaboration, fruitful collaboration, will be continued. So we should work together to provide soonest recovery and access to the essential services. And now this task is becoming a joining task for all of us. Thank you very much once again. And now I would like to turn to the representative of another high TB burden country, which plays also a very important role at the regional and global level. I would like to give floor to the Vice Commissioner of the National Administration of Disease Prevention and Control from China, to Mr. Chang Zhili.
尊敬的各位部长。
Distinguished ministers, colleagues, ladies and gentlemen, it's a pleasure to participate in the UNGA side event on progress and multi-sectorial action towards achieving the global targets to end TB. On behalf of the National Health Commission of China and the National Administration of Disease Control, I would like to thank the Russian delegation and WHO for their attention to TB control and arrangements for this meeting. At present, the COVID-19 pandemic is still very serious, impacting the healthcare system of various countries. Under the strong leadership of President Xi Jinping, the Chinese government has adhered to the people first, life first approach, taking strong measures to meet the challenge and achieved major strategic results in the fight against COVID-19. At the same time, we adhere to multi-disease prevention and actively carry out TB prevention to provide timely and standardized treatment and management services for TB patients. The Chinese government has included TB prevention and treatment into our economic and social development plan and Healthy China strategy to implement WHO and TB strategy and the political declaration of 2018 high-level GA meeting on TB with great results. TB in China continues to decline, with the average annual incidence rate falling twice the global average over the same period. The mortality rate remains very low. We are actively implementing Healthy China initiative and joint prevention mechanism for infectious diseases such as TB in various departments, give full play to the role of the joint interministerial meeting under the State Council in the prevention and control of major diseases, coordinate the participation of various departments, the joint study and promote TB prevention of the National Health Commission under 8 departments to curb TB. From now to 2023, we will further strengthen TB prevention and treatment. First, we will strengthen patient detection, improve the quality of diagnosis and treatment services, highlight key populations and areas of prevention, and actively curb the drug-resistant TB. Second, we will continue the multi-sectorial participation, fulfill the responsibilities of various departments through institutionalized communication, coordination, and monitoring mechanisms and effective measures for joint comprehensive prevention and treatment, and make continuous efforts for the goal of ending TB at an early date. Ministers, colleagues, eliminating TB requires the joint efforts of governments, partners, and people around the world. In recent years, China, Russia, and other countries, with the support of WHO, have established the BRICS TB research network. China is ready to continue to strengthen exchanges and cooperation with member states, WHO, and other international agencies to jointly promote global TB prevention and treatment and make greater contributions to realizing the 2030 health-related SDGs and WHO's strategic goal of ending TB, and to building a common healthy future of mankind. I wish this meeting great success. Thank you.
Thank you very much, Honorable Vice Commissioner, Mr. Chang-Jil. Indeed, we appreciate your continued efforts, and we can observe the progress towards ending TB. Of course, much more should be done, and we hope that you will not lose and strengthen your focus. And we also do appreciate your engagement and role in the TB research, BRICS TB research network. We have today 4 representatives of the BRICS countries, and they are not only high burden countries, but they're countries which can provide and facilitate global progress. So thank you very much. And we are still looking to few connections. First of all, to the connection of the live connection of the Honorable Minister of Health of Nigeria. Hope it will happen later. And I would like to thank all honorable ministers and other leaders for joining us today and to making a very inspiring and important statements, sharing with us experiences and examples of concrete actions which can help to move forward our very challenging but so important agenda. Let us now move to the second session. And we are very pleased to have the heads of 4 of our closest partners and leaders in efforts to end TB at the global and country level. USAID, Stop TB Partnership, UNITAID, and the Global Fund. Focus of all the distinguished speakers in this panel will be on the contribution towards sustaining and strengthening multi-sectoral action and progress towards ending TB, of course, in the context of COVID-19 crisis. Also, we are looking forward to your vision, what should be prioritized and brought as a key asks at the second high-level meeting on TB. And I am very pleased to invite my first speaker, Dr. Jennifer Adams, Acting Assistant Administrator from the Bureau for Global Health of the U.S. Agency for International Development, USAID. USAID is the biggest bilateral funder of TB efforts worldwide and to WHO's work on TB. Dr. Adams, as the largest bilateral TB donor, USAID has been pivotal in accelerating global progress. Please share how USAID support is building sustainable commitment and capacity to end TB. What more is needed to ramp up the response to reach TB targets by the deadline, especially considering the impact of COVID-19 pandemic? Please, floor is yours. Please, if possible, unmute your microphone.
You are unmuted. Can you try speaking, please?
So it can happen because we are live. We are giving you a few more minutes to improve your connection, please. Or we can give the floor to our next speaker while we are trying to solve your connection problems. Okay, thank you very much. We'll be back shortly. We now turn to Dr. Lucica Ditiu, Executive Director of Stop TB Partnership, and close friend of mine, Luchika, a significant boost in resources is much needed for fight against TB. It's not a secret. We are highlighting, we are alerting about it. If we are serious and we aim to overcome this leading infectious killer, how can we mobilize and sustain financing, and how Stop TB Partnership can lead these efforts in this area? It would be good if you could also highlight key roles of players to achieve this, including communities and civil society. Please, Luchika, go ahead.
Thank you so much, Teresa, and thank you to the government of Russian Federation for hosting this event and such an amazing lineup. You see, we have amazing targets, and we had amazing opportunities to achieve them and to actually show some progress in TB. We were hit, all of us, by the COVID storm, and what I'm afraid is, while we are in this storm, when the storm will be ended, you know, like after every storm, you look at houses destroyed, people killed, and damages all over. TB is probably the most hit of all, as we discussed, unfortunately. And it's the most hit of all because people that are with TB are the most vulnerable and belong to groups that are having a lot of challenges in accessing care. TB is most vulnerable because TB and COVID are very similar. So a lot of our resources, our human resources and finances were diverted towards COVID, but also because TB doesn't have the resources, the financial resources for a long time to fight the disease. Just to remind all of us that it's great we have commitments, but without having the resources and the funding and the people, but especially the funding, we will not be able to reach anything. And it's a collective responsibility, because knowing that in TB right now we have less than 50% of what is needed, it means that we collectively agree, admit, and we have to live with this, that we will achieve just less than 50% of the targets. It's impossible to put the pressure on people to deliver at full with less money. But as we said here, we are not giving up. As a TB community, TB was always an orphan disease. There are others that are more in the light. And whatever we do, some of us for all our lives, we don't give enough attention or resources or funding. Sometimes in a complete shock by defying any logic, TB still gets very little resources compared with other diseases that kill far less. TB killed 4,000 people per day before COVID. I am afraid that we will go to 5,000 per day in 2020 and probably even more. It's absolutely illogical on how funding is going in other places, rather than a disease that is preventable, curable, and an amazing investment in health. But, as I said, Stop TB Partnership is not just advocacy, it's trying to unite all of us into a big movement. So, Teresa, you said what we can do is we will continue to do the advocacy, but also try to unite all our partners, starting with civil society and communities and the many networks that we have out there, to demand their right for access to the best diagnosis and tools and guidance that is available. And that is secured on one hand on having these tools, and the other is funding and having the resources that they are available to everyone. It will not be an easy effort, because just with civil society and communities will not reach far. We need to have the support of the governments, and we need to have the support of donors. And I really call on donors to invest in the TB response in whatever way they think is feasible, to be able to close the gap. We don't have a gap just on access on anything. We have a huge gap in identifying, diagnosing, and treating every person with TB. We are trying very hard, and the honorable ministers presented very well what amazing efforts were done during the COVID. But I want to remind all of us that in 2019, just 28% of people with TB were diagnosed using rapid molecular tests, just 28%. 72% were diagnosed using clinical or X-ray, clinical or smear microscopy. I want to see what other disease in the world will accept a clinical diagnosis, because we in TB, we will not accept that. We will not accept that anymore. The last point that I want to make is this. we need to find the financial resources for the TB response if we are serious about reaching the 2022 and the 2030 targets. That comes not only from the donors, it comes from the domestic funding, and it comes as well from other type of funding, such as the Global Fund. It will not be an easy conversation, but we really need to come together and think about it. I rely very much on the TB survivors and people living with HIV, people living with TB, people living with HIV/AIDS, people living with malaria, because it's not a situation in which we can invest and save lives of people with, for example, that they don't die of COVID and allow them to die of tuberculosis a bit later. I want to thank you very much, Elena and Teresa and everyone here. I want to, I hope that this discussion will continue further. Thank you very much.
Luchika, thank you very much for your strong, passionate advocacy. You are literally spending all your time 24/7 to advocate for TB. And I believe and I hope that your strong voice will be heard. And we will see a real additional investments and support from both from the domestic resources and international donors. And now I would like to come back again to our first speaker, Dr. Jennifer Adams. I hope now we've managed to provide better connection. And please share with us how USAID support in building this sustainable commitment and capacity to end TB, and what more, on your point of view, needed to ramp up the response to reach our ambitious but still achievable targets.
Thank you, Dr. Teresa. Thank you. I think everybody can hear me now. So good morning, good afternoon, good evening to everyone, colleagues on the panel, and everyone participating from all around the world. I'd like to also thank the World Health Organization and the Permanent Mission of the Russian Federation at the UN for hosting this important event about TB. As the lead agency for the US government and the largest bilateral donor in the TB response, the US Agency for International Development works with partners all around the world on the shared goals of reaching every person with TB, curing those in need of treatment, preventing the spread of new infections, and stopping the progression to active disease. It's been 3 years since the UN high-level meeting on TB, when all of us made significant and important commitments to the ambitious global TB targets. At the same time, we at USAID launched a new model for TB called the Global Accelerator. And for the next year and a half, we made a lot of progress. In 2019, more people had access to TB services. There was an 11% increase with people diagnosed and started on quality treatment. Furthermore, our joint efforts contributed to global TB incidence decreasing by 29%, TB mortality decreased by 47%, and case notifications increased by 126%. In USAID, with our accelerator, we shifted our model to a more local, grassroots-driven approach. We were able to build strong commitments with ministries of health through joint TB partnership statements and roadmaps that were produced in more than 20 countries. We've also continued to increase the TB network capacity by embedding 60 technical advisors in national TB programs. That is on the government side. In addition, we directly partnered with local organizations and worked to empower community organizations to expand access to services, and especially for the really hard to reach populations. So the renewed energy and attention around efforts to end TB was also, I think, important in contributing to these gains. So following the 2018 UN high-level meeting, we saw increased domestic resources and political commitment at the highest levels. Unfortunately, though, as others have highlighted in speaking today, the social, economic, and biomedical consequences of COVID-19 created a perfect storm for TB and for other public health issues. The pandemic's impact has been particularly devastating for the most vulnerable and the poorest populations in low and middle income countries. I recently came back from being the USAID mission director in Mozambique, and I saw this firsthand. COVID-19 stopped services, interrupted people's access to health centers and health clinics, including essential TB services, such that the National TB Program in Mozambique reported that the number of people diagnosed with TB dropped by half. Also, at the onset of this pandemic, TB personnel and services throughout the globe were repurposed and deployed in response to COVID-19. And that was precisely because so many of their skills and experience in active case detection, contact tracing, and airborne infection were needed for this unprecedented pandemic. So with this, we've seen alarming drops in the number of people tested and treated for TB and drug-resistant TB. In 23 countries where USAID works, 1 million fewer people had access to TB diagnosis and treatment in 2020 compared to 2019. To mitigate this, working alongside countries' TB programs, the Global Fund, and other partners, USAID is currently executing a TB recovery effort in 7 high TB burden countries that have been the most impacted. These recovery activities are focused on increasing access and improving the quality of TB services. So that includes simultaneous testing for TB and COVID-19, strengthening diagnostic networks, community-based case finding, and expanding the use and availability of adherence tools. New tools, a number of which were rapidly developed and adopted to support TB during COVID-19, have been and remain critical to countries' recovery and the overall efforts to end TB. A couple of examples. USAID supported the introduction of computerized pillboxes, screening and tracking apps, mobile apps, and video adherence monitoring technology. USAID has also supported the scale up of all oral treatment regimens that are easier and safer for people with multi-drug resistant TB, and they've proven to be especially critical during this period of pandemic-related restrictions when people had limited access to healthcare services. So these new regimes, these new technologies are playing an important role in supporting TB patients, and they're some of the few bright spots that have come out of this very challenging time. So we're focused on mitigating COVID's impact on TB, and particularly the key interventions that make the biggest impact. So that's a very important priority for USAID. We also feel like we need to continue to work on increasing political commitment and investment in TB. It's our hope that the 2023 high-level meeting will once again draw that kind of attention and action, and this time to help us recover from the pandemic setbacks and move forward. And it's going to be worth it if we can get that attention, because as we've seen during the pandemic, when so many TB systems and staff were used against COVID, these platforms can be systematically utilized, and they provide a vital foundation for future airborne pandemics. So investing in TB in all these systems, as well as in the people, makes a lot of sense. So we've learned a lot over the last year, and we know we can't continue business in the usual way that we have in the past to fight TB. It's one of the oldest infections in the world. It's critical to innovate, critical to adapt our programs, and try to aggressively drive innovation and commitments that we need to reach the UN global targets and ultimately to end TB. Thank you.
So thank you very much, Dr. Adams. I can't agree more and can't support more all of your key messages. And thank you once again for non-stop support, very strong support to the high burden countries, to WHO in all key areas. It's really vital, especially nowadays. And a special thanks to you for your last point, that we are all learning from this COVID situation. But one of the lessons definitely that our previous investments in TB programs now are bringing benefits not only for TB programs, but also to respond to the new threat, because new threats are coming and leaving, and we hope that their life cycle is much shorter. But TB unfortunately remains with us. It's ancient disease and still with us, and that's why we can invest more in the programs, and we can receive more gains, benefits benefits from these investments. Thank you very much once again. Let's move together that direction. So now I would like to give floor to our close colleague, partner, important partner, to Dr. Philippe Duniton, Executive Director of Unitaid. Unitaid is leading efforts on innovations to end TB. Given that we're just 1 year away from reaching 2022 TB high-level meeting targets, how can we harness research and innovation to accelerate the TB response, building again on lessons learned from the COVID pandemic? We see how fast, if there is high-level commitments, we can find resources, invest and receive several vaccines and other innovations, how we can use effectively digital technologies. Please tell us what you think and how is Unitaid leading efforts in this area?
Thank you, Teresa, and good morning, good afternoon, good evening for all the participants, and thanks for the Federation of Russia to have organized this high-level panel. A lot have been said already, and just I think that just to recognize also the specific issue of TB, it's an old disease that needs new solution, that's for sure. And we share all the concern that was expressed with the particular situation in the COVID-19 pandemic. I think that a lot of people have been already very vocal in terms of the threat, the challenge of missing people in terms of diagnostic, which was the case before, 1/3, but basically we know that the situation is not good, and of course, we don't know yet when and how we will get out of this situation of COVID-19. I think that it was said also, in particular by Lucica, but also our colleague from USAID, that we need, despite the challenge in how can we reach the goal and the question of resource, which is absolutely key, we need also to consider the kind of innovation that was already mentioned, but it's again a collective effort, it's a partnership effort with the countries. And I think that the representative from the civil society in Indonesia was also very vocal on the need to have new tools. So what it looks like, I think that there are things that are even more relevant now than ever. I just want to take the example of the rifampicin, the prevention of treatment for TB among the people living with HIV, which is also another phase of the TB situation. And the fact that it's more than ever important to scale up that kind of preventative treatment to address the situation where the challenge is to take care of the people living affected by TB in this particular circumstances. One other thing is also to increase and double down on the test. I think that Lucica made the point in terms of, do we accept even in COVID, by the way, to look at the disease without proper diagnostic? The response is we shouldn't. And I think that the point made is also for the need to have new type of diagnostic, even simple one, that can come to the market and be used. So that's an investment that Unitaid is really considering, and we will have an announcement in the next couple of weeks to invest in that new tools for diagnostic, which is absolutely key. And we are under development on the next step for the coming month. So again, we have a lot of investment in diagnostic for TB, and we will continue because we believe that it's for the detection, but also for the treatment it's a key element for now and the future. Another type of important thing that we should do, and we have an intervention into that, is the adherence. Of course, it was mentioned by USAID. I think that how we can simplify with e-health in a way, system that can help the people to stick to the treatment or the preventative treatment is absolutely key, because we know the burden of asking the people to be monitored on site. So there are alternatives, and we need to make sure that, of course, there is a safety for privacy, but also effectiveness of this tool. So we are working on that, and of course, it's a partnership effort. The last point I want to make is also we need to have a better treatment, a more simple treatment, because it's also shorter. So, of course, two examples of that, we have been for a long time looking at pediatric formulation for TB for the first line, and I think that it was a good move, and now it's the uptake is quite important. But I think that we need also to address, and this work that we are doing with Institute of Oram in South Africa, to think about the simplification of treatment for MDR-TB for children. So we are expecting good outcome. It will not be as simple as the first line, but it's absolutely key if you see the burden of pills for many of the children that are affected, and I hope that we can have a solution, a better solution for them. Another example again is also all the effort in MDR-TB. We are supporting world-class clinical trials on that with partners. I think again a lot of effort are done also by WHO to that of the response in terms of TB. So I will stop there. Thanks for the partnership. I think that we will not really address the needs for a lot of TB people without a strong partnership and strong collaboration with countries and civil society. Over to you, Teresa. Thank you.
Thank you very much, Philippe, and thank you for excellent collaboration and bringing innovations faster and closer to the people. Yes, we don't have effective vaccines for TB, still using 100-year-old vaccine, but we have much better options, which are unfortunately also not accessible to all the people due to lack of investments and all other arrangements. Let's work together to do it and implement our latest WHO guidelines. Now, I'm very pleased to greet and to invite Peter Sands, the Executive Director of the Global Fund, who is joining us. We know that today is a very busy day for you, and we would like to use this opportunity and congratulate Global Fund and you as an Executive Director with an important anniversary. You have a unique mandate, unique portfolio focusing on 3 diseases of the poorest people in the world and the whole world with hope, especially low and middle income countries looking at you. So I know that you prefer, as a leader, as a manager, evidence-based decisions, data-based decision, and we're always following your requests, and you see now providing monthly data from the countries. We hope that you have it. And also we have all the data which literally alert that more investments are needed, and please tell us, what do you think, how we can redouble our efforts and investments to reach our 2022 targets, especially in the context of COVID-19. So what resources can be leveraged, how the Global Fund is leading the way. Please, floor is yours.
Thank you, Teresa, and thank you to the Russian Federation and to the WHO for hosting this very timely event. It's very easy to get quite depressed about the state of the fight against TB right now, given the challenges that COVID has created and the setbacks in so many programs in so many countries. But I want to start actually by reminding people of the progress that was being made following the 2018 high-level meeting. Because in fact, the TB community, governments, civil society, agencies like the Global Fund, USAID, WHO, came together and did make significant progress. Domestic financing for TB was on a sharply increasing trajectory up until the pandemic struck. The Global Fund, in its replenishment, put itself in a position where on average, TB allocations could increase by 23%. Indeed, 84% of countries in this new cycle saw an increase in their TB allocation. And most importantly of all, we were actually seeing the results affecting people. Jennifer gave some very powerful statistics. We were closing the gap on the millions of people who are missed from being identified and therefore being put on treatment. And I say this not to underestimate the stark reality of the situation we're facing right now, but to remind people that we have agency, that we can act, we can make a difference, we can regain momentum and recover lost ground. We should not be defeatist or fatalist. We should keep the ambition. That said, we also have to recognize the stark reality of the situation we face. Of the 3 diseases the Global Fund deals with, it is undoubtedly the case that TB has been the most negatively affected by the pandemic. We've seen a diversion of domestic resources. We've seen a diversion of human capital, of leadership, of infrastructure. And because of the setbacks, hundreds of thousands of people more have died of TB. This is the grim reality of what we face. Now, the Global Fund, USAID, governments, civil society have not been passive in response to this. It would have been worse if we hadn't seen the kind of concerted, decisive action to respond to the pandemic. At this point, the Global Fund has, on top of the spending on HIV, TB, and malaria, committed over $3.6 billion to help countries respond to COVID-19 and to mitigate the impact on the 3 diseases. Indeed, 2021, we will be spending more money on TB if you combine the 2 than we've ever done before.
Yeah.
Mr. Ahmed from UAE.
That said, it is not nearly enough. We all know that. It wasn't enough before COVID struck. It's even more not enough now. So we are going to have to rediscover some of the spirit of ambition that we had following the 2018 high-level meeting to actually galvanize more funds, more commitment, more innovation. There aren't that many different sources of money to fund the fight against TB. Domestic resources, we have to be realistic. They'll be under huge pressure because of the economic shocks. There'll be huge demands for pandemic preparedness, for COVID-19, for all sorts of things to mitigate the socioeconomic impact of the crisis. However, we need to be very vocal in making the argument that cutting back on progress on TB is like shooting yourself in the foot. TB affects the most economically active people at the most economically active age. We all know that the return on investment of dealing with TB is incredibly high. We need that argument to be made and tailored to the specific context of multiple countries to protect and sustain domestic resourcing. We need, next year, a successful replenishment of the Global Fund. The Global Fund is something like 77% of all international financing, so it is vital that a successful replenishment of the Global Fund is a foundation for increasing the resourcing for TB. We need to get the multilateral development banks more involved, more blended finance. We need debt swaps. We need to use all the concessional financing that we can find. And this is particularly relevant for TB, given that so much of the high burden countries are countries with some debt capacity. We also need to position TB within the whole debate and all the resources that are going to be dedicated towards pandemic preparedness and response. And that's not artificial. That's because investing in TB means building infrastructure and capacities that we know, because we've seen it with COVID, are incredibly valuable when responding to a new pathogen, particularly a respiratory pathogen. It's a real logical argument. Invest in TB and you will get better preparedness for the next respiratory pathogen. But we need to make that argument in the most compelling, hard-nosed, economically powerful way that we can. And we need also to really, really focus on value for money, on making the best use of every innovation, whether it's a biomedical one or in an approach. And actually, COVID has been a catalyst, as others have mentioned, for some really good innovations. But all of this, I suspect, will still leave us with a gap. And to close that gap, I think we need to change the framing, change the perception of how we look at TB. And I just want to invite you all to join me in a little bit of a thought experiment. Suppose TB didn't exist, but suppose tomorrow a new pathogen emerged and we discovered that 25 to 30% of the world had this pathogen in latent form. It was killing 150,000 people a month. It was present in hundreds of countries around the world, and it had a particularly nasty set of versions that were resistant to most of the drugs that we had available, and it had a capacity to evolve in really nasty ways. Would we really be satisfied with saying, oh, we might have a vaccine in 4 or 5 years? Would we really be satisfied with the kind of diagnostic capabilities that Lucico and Philippe talked about that we're dealing with now? Would we really be satisfied as a world with some of the treatment regimens, and so many parts of the world are still using treatment regimens with really nasty side effects? We wouldn't. We would be looking at this new disease and we would be saying, if we could get a vaccine for COVID in 300 days, why can't we have one for TB? If we can get the kind of power and availability of diagnostics that we now have for COVID, why wouldn't we for this new disease? And we would be looking for treatments that were easy to provide and better for patients. And I think we need to sort of use that way of thinking about it. We shouldn't let the fact that TBs have been around with us for hundreds of years to let us be complacent or be satisfied with an inadequacy of the research and development pipeline or the things that we can offer to protect and treat people. We need a degree of outrage about it. We should say, if this was something new, we would be approaching it in a such different way, and we would be approaching it with a kind of decisiveness about the way we fought it that is very different from where we are. So I think we need to rekindle our ambition. We need to challenge people to think about TB as if it were the next new pandemic. And we need to examine everything about what we're doing and how we're financing it to push the envelope, because TB's been around too long. Too many people have died. Too many families, too many communities have been blighted, and we need to end it. And we need to use the COVID crisis, not just as a shock that has made things worse, but as a catalyst to finish it and make things better. Thank you.
So thank you very much, Peter. Thank you also for our strong partnership. And you know that I'm listening to you and think that you are one of the most outstanding and strong advocates for TB. And I think definitely you will be able to bring additional resources during the replenishment for TB. And we think that the world should indeed look from another angle to the problem of TB TB, and TB indeed is now in crisis. And we are alerting this, and we can see with the number of death, additional TB death, hundreds of thousands additional, how fast the situation is worsening with this continuation of the drop in TB notifications. So that's why we should immediately undertake the decisions. So let's continue working together, and I believe we have very good chances to bring more investments and more attention to TB. Thank you, Peter. We are running out of time, but still we have with us very important speakers, and we would like to give a floor to them. First, Dr. Hussein Al-Rand, His Excellency Assistant Under Secretary at Ministry of Health and Prevention of the United Arab Emirates. Please, Your Excellency, floor is yours.
Excellencies, ladies and gentlemen, greeting from United Arab Emirates. I am taking this opportunity to emphasize the importance of executing the global strategy to end TB and commitment of United Arab Emirates in supporting the global action to reach the target by 2030. In United Arab Emirates, we are working perceptibly to fulfill the end tuberculosis framework, where there is political commitment, government-funded universal health coverage, and a regulatory framework for management, quality, and protection use of medicine and infection control. United Arab Emirates has one of the lowest incidence rate of TB, with treatment success rate touch 86% and reduction in deaths by 80% in 2019 compared to 2015 for the pulmonary TB. During COVID pandemic, we have maintained the continuity of essential service for people affected by TB, despite the all disruption in the service delivered that tuberculosis program experienced globally. This was done by encourage simultaneous screening for TB and COVID, use telemedicine and call centers to support TB patients and identify a screen contact to limit in-person visit to health center and allow for frequent consultation. Ensure access to medication by provide TB patient with at least 2 to 3 months supply of medication to decrease frequency of consultation at TB facility. Switch to oral regimen for patient with drug resistance. Mobilize both public and private health sectors in collaborative COVID and collective COVID-19 and TB response. Implement home isolation approach as an alternative to hospitalization. This was applied under the efficient monitoring and follow up the procedures. Excellencies, ladies and gentlemen, the progress which made toward TB elimination in United Arab Emirates highlight the lessons learned and process and the step to reach the international target toward TB elimination. So enhancing TB surveillance, early cases and latent TB management using innovative new diagnostic and technology, encourage public-private partnership and have a sufficient and sustainable financing for TB program. From here, I express UAE commitment to continuously support the multi-sectorial action toward achieving global target to end TB, and take this opportunity to thank Russian Federation for arranging this supported meeting and recognize all their efforts beside the UN, WHO, and other country and the stakeholder in this matter. Thank you, sir.
Thank you very much, Honorable Dr. Hussein Al-Rand, for joining us today. It's great to see such a strong commitments from the low TB burden country, and we really need champions in TB elimination. We should show that it's possible for this ancient disease to be eliminated in the countries, and it will be important driver of the global progress as well. So now I would like to give a floor to our last but not least least speaker for today, representing Honorable Minister of Health of Nigeria, Osagi Ehaniri, National TB Program Director of Nigeria. Please, the floor is yours. So we can't hear you. Please unmute yourself.
Your Excellencies and distinguished participants, thank you very much for giving me the audience to speak on behalf of the government of Nigeria. And the Honorable Minister of Health would have loved to take active part on this, but due to unforeseen circumstances, he was not able to and has asked me to step in. Just to say that we are very pleased and happy from the development partners, especially WHO, USAID, and other ones I cannot mention now, run in tandem with the commitment at the UN high-level meeting in 2018. We have put in several measures, costed plan, to ensure that we kick out tuberculosis in the country. And most of them is yielding. At the moment, from 2018, we were able to increase our service delivery points with an increment of 84%. Initially, we were having 9,000 facilities, but as of 2020 ending, we have 17,099 healthcare facilities in the country. Also know that Nigeria is a very big country, and with all these challenges, we are trying to make sure that we do our best to run in tandem with the given target. Due to in 2020, with the advent of COVID-19, we had to review our strategies, and that's helped us to increase our case notification highest ever to 138,519, which places Nigeria as one of the countries that were able to make an increment even in the midst of COVID-19. We have also improved our collaboration, TB-HIV collaboration, ensuring that a staggering number of them are screened for tuberculosis. At the moment, we have 95% of them with status, HIV status, and above 91% of them on antiretroviral drug. We have changed our system of trying to improve more on the public-private partnership, because we realize that 60% of Nigerians seek for help from the private health facilities. So we have put on strategies to engage more of people in the private sector, and that will help us to drive in increasing access, increasing case notification, and placing them on treatment, all in a bid to cause the chain of transmission, which is one of the cardinal strategies of kicking out tuberculosis in the country. I want to use the opportunity to thank our partners and all that has put in resources to make sure that we do the needful in the country. And we're also putting strategies of making engagement to the government to increase domestic funding and to ensure that we increase our diagnostic spread amongst all the states in the country. We are promising that every effort we put in place to make sure that we run in accordance with the target of achieving universal health coverage, especially leaving no person behind in terms of tuberculosis control in the country. So on behalf of the Honorable Minister of Health, I want to thank everyone and for this audience, and we are convey this message to him while we put all our hearts together to make sure that we kick out tuberculosis in the country. Thank you very much.
We thank for the connection and sharing your commitment and overview, Honorable Representative of the Minister of Health from Nigeria. So colleagues, I can't thank and appreciate more your time, your strong commitment, your passionate hard work for people still suffering and dying from TB, preventable and curable disease. And today we've discussed a lot about our deadlines, targets, timeframes, high-level events and commitments, but all this discussion had a name and only to attract attention, to use this as a mechanism of moving forward the very heavy, challenging TB agenda, to keep in mind suffering and enormous hardships of millions of people today in the world facing TB and their families. So thank you very much once again to the audience for staying with us, asking questions. Unfortunately, we are not able to respond live to these questions, but we've provided responses in the chat and also shared email where you can, which you can use and ask further questions if you will have. This session will be also posted on web, and we have a really growing and a big audience which can translate these key messages from the meeting to the world and to the decision makers. I'm now pleased to invite Dr. Ren Mingui, WHO Assistant Director General for the Universal Health Coverage, Communicable and Non-Communicable Diseases. He heads the division the Global TB Program is housed under, and the champions anti-TB efforts with unwavering support. Dr. Ren, would appreciate your closing this important event.
Thank you, Teresa. Excellencies, honorable ministers, distinguished guests, dear colleagues and friends. Let me first of all thank you very much for this very important, inspiring, and constructive discussion, which has clearly demonstrated strong commitment from the countries, partners, and civil society to accelerate the momentum towards ending TB. I would also like to sincerely thank the Russia Federation for co-sponsoring this event, our immense speakers and panelists, and you, our wonderful audience, for joining us today in keeping the spotlight on ending TB during the global response to COVID-19 pandemic. Today's dialogue intervention has been critical, especially as we have 1 year left only to reach 2022 United Nations high-level meeting targets on TB, and also as COVID-19 has set back gains made over past years. We need to act with urgency, and we need to do so now. I see the few takeaway from today's discussion. Countries need to redouble their efforts and investment to ramp up the TB's response in tandem with ongoing efforts to combine COVID-19 pandemic. We all, WHO partners, civil society, needs to support them in doing so. Our success in ending TB depends on our ability to work boldly across sectors to expand beyond TB, ensuring links to broader global health agenda, objectives of universal health coverage, and engaging with sectors beyond health. This is why the commitment made by heads of states at 2018 high-level meeting on TB are of such tremendous importance. And that is why also why the 2023 United Nations high-level meeting on TB is so important. The meetings offers a powerful opportunity for heads of states to review the progress in the fight against TB, to renew their commitment. It was inspiring to hear the commitment expressed today by the President of the United Nations General Assembly, the Deputy UN Secretary General, and our WHO Director General. We at WHO look forward to joining our efforts with you in preparing 2023 high-level meeting. Ladies and gentlemen, TB remains one of the world's greatest infectious disease killers after COVID-19, claimed millions of lives, causing suffering to the millions more. We cannot offer to be complacent. We need to act now, and we need to do so with determination to ensure universal access to life-saving TB quality care in line with our commitment towards universal health coverage. This is even more critical today as COVID-19 continues to place a heavy burden on the people with TB and other diseases. We need to keep our promise. There's no moment to lose. The health of millions of people and their families rests in our hands. It is a huge responsibility. We cannot let them down. Together, we can and we will make a difference. The clock's ticking. It's time to end TB. Thank you all, and also thank to our excellent WHO colleagues and to our interpreters. Now I'm handing over to our co-chair, Minister of Health of Russia Federation. Thank you very much.
Уважаемые коллеги,
Distinguished colleagues,
подошло к концу наше сегодняшнее
at the end
мероприятие.
of today's event, I would like to thank
генерального директора
the Director General of the WHO, Dr. Tedros,
Всемирной организации здравоохранения, Терезу Кисаеву.
I'd like to thank Dr. Teresa for moderating today's session. I would also like to thank the Ministry of Health and delegates of UN countries, agencies and programs for a fruitful discussion. We've all mentioned how important the issue of TB is, and we're all on the path to solving the problem. We have seen results of pooling our efforts to tackle TB through norms, strategies, and we know that this is very important, of course, as well as controlling NCDs and infectious diseases. Only through joint efforts and with the WHO playing a leading role can we achieve the aim of ending TB, which is a political priority on the 2030 Sustainable Development Agenda. Of course, I'd like to wish everybody success. I wish you good health, and I hope to see you all at the next high-level meeting on TB. Thank you very much.
Thank you very much, Honorable Minister Mikhail Murashko, for initiating and co-chairing this important event together with the WHO. To be continued.